The CDC defines the cycle in 5 domains. First, problem identification, realizing something is wrong. Second, policy analysis, figuring out what to do about it. Third, strategy and policy development, drafting the actual rule. Fourth, policy enactment, getting it passed. And fifth, policy implementation, actually making it happen. Surrounding all of these is stakeholder engagement and evaluation. It looks like a circle, but in reality, it's a messy spiral. You often get to step 4 and get kicked back to step 1. Step 1 is problem identification. This sounds easy, but it's philosophical. We must distinguish between a condition and a problem. A condition is just a fact. It rains in Seattle. A problem is a condition we believe we can and should change. The roof is leaking. Poverty was once seen as a condition, a fact of nature. Now it is seen as a problem, a policy failure. How you frame the problem determines the solution. If you frame obesity as a problem of personal willpower, the solution is education. If you frame it as a problem of a toxic food environment, the solution is regulation. The framing is the first ethical act. Step 2 is policy analysis. This is where you brainstorm solutions. You look at the evidence. What works? What costs too much? This is where you weigh the trade-offs we discussed. You must always include the do-nothing option. Sometimes the cure is worse than the disease. Policy analysis is where you strip away the rhetoric and look at the math. If a program saves 1 life but costs $1 billion, is it a viable policy? That is a cold question, but it must be asked. Step 3 is strategy and development. Now you have to write the bill. You have to choose your mechanism. Are you going to tax cigarettes, ban them, or just put a warning label on them? Each mechanism has a different impact on liberty and efficiency. This is also where you start building your coalition. You talk to the stakeholders, the doctors, the patients, the industry. You try to find a version of the policy that can actually pass. This is the art of compromise. Step 4 is enactment. This is the vote. This is where the lobbyist earns their paycheck. We will talk more about policy windows in Module 2, but essentially timing is everything. You can have the best policy in the world, but if the political mood is wrong, it will die. Enactment is where ethics meets power. Sometimes you have to water down a moral policy to get the votes to pass it. Is half a loaf better than none? That is an ethical dilemma. Step 5 is implementation. Policy students often ignore this, but it is the most important part. A law is just words on paper until a bureaucrat enforces it. Michael Lipsky coined the term street-level bureaucracy. The police officer, the teacher, the social worker, they are the ones who actually make the policy in the moment. If they interpret the rule differently than Congress intended, the policy changes. Implementation is where the unintended consequences happen. You pass a law to stop opioid abuse, and suddenly chronic pain patients can't get relief. You must monitor implementation religiously. Surrounding this whole cycle is stakeholder engagement. The ethical principle here is nothing about us without us. If you are writing a policy about disability, you must have disabled people in the room. If you are writing a policy about rural health, talk to rural doctors. Failing to engage stakeholders is not just bad ethics, it's bad strategy. They are the ones who will sabotage your implementation if they feel ignored. You need to identify who has the power to veto your idea and bring them into the tent. Finally, evaluation. Did it work? We are terrible at this. Politicians love cutting ribbons for new programs. They hate funding studies to see if the program is actually effective, but ethical policy demands evaluation. We need to know if we are wasting money or hurting people. We distinguish between process evaluation, did we distribute the vaccines, and outcome evaluation, did disease rates drop? Sometimes you succeed at the process, but fail at the outcome. To conclude Lesson 4, the policy cycle is a map, not the terrain. Real life is messier, but this map gives you a way to diagnose failure. If a policy failed, did it fail because we defined the problem wrong, or because we botched the implementation? As we move to the final lesson of this module, we are going to step back from the mechanics and ask the spiritual question: why do we do this work? We will discuss faith, vocation, and professionalism.